Dr. B, Dr. Brent Wallis, Chief Medical Officer at People's Health, is going to join us now to give us some advice on physical activity. Good morning, Dr. B. How are you?
Hey, Tommy, I'm doing good. It's good to have you back.
Yeah, it's been a while between both of us being in and out and all that stuff, but the team's back together again. Doc, can physical activity help you live longer? And is it possible? Can everybody enjoy the health benefits of physical activity if they just get going and do some stuff?
Yeah, absolutely it is. Physical activity is incredibly important for your overall health, and there's been a lot of research done on this, but staying active really increases your chances of living longer. And really, the way it works is when you're inactive, you tend to gain weight, and becoming obese is a huge risk factor, for all the things that cause death in the United States, things like heart disease, diabetes, and stroke. So really staying physically active regularly, so doing it very consistently supports your overall health and reduces those chances of developing diabetes or metabolic syndrome and really maintaining your healthy weight. And it really can also keep your mind sharp.
Yeah, I noticed that after I get off the elliptical machine, and I don't mind doing it, really, I don't, but it's amazing how you feel mentally so much better as well as physically. What's going on there? Is that just me, or does that happen to everybody?
No, there is a direct connection. Physical activity really has an immediate effect on your brain health. And so, like you're saying, after a workout, you feel more energized. You've got more energy. You can do more. That's related to the endorphins that are released while you're exercising. And that's why we tell people morning workouts are really a great way to start your day, because it can improve your mood, boost your self-confidence, make you feel better for the rest of the day. It's also why we say exercise late at night is not necessarily a good thing, because it's going to activate you and may, prevent you from falling asleep. But in general, physical activity really can reduce your risk of depression and anxiety. If you do exercise in the morning or in the midday, it can really help you sleep a little bit better at night. And sleep is incredibly important to your health as well.
How much activity is recommended? Does it change as you age?
Yeah, it definitely does, and it varies person to person, and definitely varies with your age. I mean, we all know children need more moderate to vigorous activity when they're younger. For most adults, and definitely in our older population, at least 150 minutes a week of moderate intensity activity is recommended. And usually the way we break it down is we say 30 minutes a day, 5 days a week. You get to take 2 holidays during the week. And really that's something that's pretty simple you can do, and it doesn't have to be, you don't necessarily have to go to the gym. You can walk around, you can go biking, you can dance. You really want to kind of pick some activities that are tailored to what you like and something that you'll keep up with. And then another thing I always tell people is it's good to vary it a little bit too. Maybe 2 days a week do strength training to help your muscles. 2 days a week do a little bit more of cardio. There's a lot of easy things you can do, things around the house you can use to actually help you exercise. Those big detergent bottles, for example, you can use those as weights. So you don't necessarily have to invest a lot of money in your equipment to get a good workout.
Why is it so important to focus on physical activity and strengthening?
Well, I mean, the important thing is that as you get older, your bones lose density. And when they lose that density, you're more at risk for falling down and possibly having a fracture. So if you do strength training exercises, you can actually help to build bone and slow the progression of the loss of the bone. The other thing is, as we get older, we tend to lose muscle mass. And so you want to try to maintain that mass, because the stronger muscles you have really do lower your risk for falling. And as you get older, one of the biggest risks we have, is falling down, breaking something, and then really having a lot of critical problems that follow that. It can definitely also help with arthritis, or, if you've got achy joints, exercise can really help to kind of lubricate those joints and make you feel better. And then you can really kind of go about your day and do all those daily activities that you need.
So you do better to have 5 days at 30 minutes than 3 days at an hour, right?
Yeah, it's better to be a little bit more consistent with it. So 3 days on and 4 days off, that's a pretty long time without physical activity. So try to break it up a little bit more. And it doesn't have to just be 30 minutes. That's kind of the low bar there. So if you can do a little bit more, that's even better.
Of course, the idea, the whole goal is to be healthy. So do you have some tips for safe physical activity?
Yeah, definitely. Anytime you're starting a new physical activity or an exercise program, you want to talk to your doctor about what you should and what you should not do. But a couple of things to keep in mind is really know when to slow down or stop. And, so when you're exercising, you should be able to carry on a conversation with someone. So if you're walking with somebody and you're not able to speak, you feel short of breath, you really need to slow down, stop, and rest a little bit and kind of assess what's going on. The other thing that's critical, especially in the summertime like right now, is drink plenty of water. You're probably starting off at a deficit. You want to make sure you're really well hydrated. Replace the water after you exercise as well, and that will help to prevent muscle cramping and maintain your body temperature. And keep in mind, sports drinks have a lot of salt in them, so be careful with that. Don't just replace with sports drinks because sometimes that can cause some additional problems. Talk to your doctor about that. And then the other thing is warming up and cooling down is critical. So if you jump into an activity immediately, you're more likely to hurt yourself. So you want to kind of start slow, warm up your muscles, make sure you're stretching, do your activity. And then on the backside, you want to cool down as well. So you don't want to, jog around the block and then stop immediately because you're going to have more aching if you do that. You want to slow down and then stretch again, and that's going to keep your muscles, a little bit active and prevent problems. And then, one other thing to keep in mind is if you do have a lot of medical problems, especially diabetes or heart disease, make sure you're carrying your cell phone with you or maybe get one of those medic alert bracelets, because if something does happen while you're out, maybe walking around the neighborhood and you do have an issue, you want to either be able to contact somebody or, God forbid, if you collapse, you want somebody to know what's going on with you. And, the last thing I'll mention, because people do this when they exercise, is don't hold your breath. Especially when you're doing strength training, some people will hold their breath to lift something up. But when you do that, it actually raises your blood pressure, and that can be bad for your body and bad for your heart. So make sure you're trying to relax and breathe out while you're working your muscles and breathe in when you're relaxing.
All right, it's 8:21. We're talking to Dr. B, our friend, Chief Medical Officer, Dr. Brent Wallis at the 5-Star People's Health Network. We're talking about physical activity and the importance of staying active, and it really is true. Use it or lose it, especially if you got achy joints, because it's hard to get them going, but once you do get them going, they get all lubricated up and you feel a lot better. 8:21, time for traffic now on WWL. 8:26 now, Tommy Tucker, WWL, Thursday morning, talking to Dr. B. Dr. Brent Wallis, the Chief Medical Officer of the 5-Star People's Health Program, and we're talking about staying active to improve your health. And Doc, somebody texted in and said that they service pools for a living. Does walking with my equipment and cleaning pools count as exercise? And I guess that brings us to some activities that maybe people can incorporate into their routine every day.
Yeah, definitely, and absolutely. Cleaning a pool is a lot of hard work, and so that definitely counts as exercise. And you may want to jump into the pool; it's so hot out there, And swimming is a fantastic exercise that you can do as well if you've got a pool or access to a pool. But there's a lot of things around the house you can do. Not that they're necessarily fun, but household chores do burn a lot of calories. So, mopping and vacuuming and sweeping, that actually is something you can do. Getting outside and gardening, as long as you stay hydrated, that can actually be very helpful as well. And one thing I do, because my dog forces me, is walk around the neighborhood every day. I come home and he's ready to go, and so we run out the door and you get to see all your neighbors and walk around and both get a little bit of exercise. And I tell people too, if you watch TV, TV, you're just sitting there, you're not being very active, and people even skip commercials. commercials. Well, don't skip the commercials. Get up and actually walk around, do jumping jacks, whatever. Don't just sit there for an hour-long program. Use those little 2, 3, 4-minute breaks to get up and move around. And, and always keep in mind, physical activity really helps to build your immune system as well. So it's not only good for your physical health, but it also helps your immune health also.
That's a great idea about the commercials. What about some tips for sticking with it? You start off, and then before you know it, you get out of the habit.
Yeah, that is really the hardest thing to do is to stick with it. And so, a couple of things you can do is don't be secret about it. Make sure everybody knows what you're trying to do, that you're trying to be active because you want them to support you and kind of congratulate you that you're able to do it. And even ask them to come along with you, come and walk around the block with me. And then, keeping track of your progress is good too. It's very satisfying sometimes to hang a calendar and every time you exercise, put a little tick mark or a hash mark on the calendar so that you can see it every day, kind of inspires you and everybody can see what you're doing. And then, I mentioned kind of alternating between strength training and cardio. That's important to change up your routine because you can get bored with the same activities over and over. You want exercise to be more fun. And you also really need it to be convenient. So while gyms are great, if you join a gym that's 10 miles away, you got to get in the car every day to drive there. You're not going to do it consistently. So you want to do something that's in your neighborhood or something that's close by you're going to really stick to. You really want to make sure there aren't things that always will come up that prevent you from getting that exercise. So really get started. That's the hardest part, and then hopefully you can maintain it.
Tell me a little bit about People's Health and a 5-star rating, please.
Yeah, sure. So People's Health, we're very excited. We are a 5-star Medicare Advantage plan, and that 5 stars is really a sign of the quality. It's the highest quality rating that you can receive from CMS, which is the Medicare Services branch of the government. And so we're very excited to be able to provide excellent quality to all of our members. Thank
you, Dr. B. I appreciate your time. Clean that pool from the inside out, right?
Yeah, definitely. Dive in there.
You have a good week. Dr. B, Chief Medical Officer of People's Health. To find out more about People's Health, you can always go to peopleshealth.com. You can visit the People's Health United Healthcare Medicare Center, 3017 Vets in Metairie. That's next to Party City. They'd like you to make an appointment, but if you want to just walk in, you're welcome. You can call 1-800-978-9765. And, of course, you can follow People's Health on Facebook, Twitter, and Instagram.